read a lot of it. And he's very broad in his approaches. He's innovative, and you'll learn a lot about it, going all the way from laboratory work to field work, doing both excellent. So he's going to talk about the chain of medicinal plants.
Thank you, Brad. I think we are developing a theme here with very different approaches, and this is really what are some of the core challenges. And I would say both what you just said and what Brad said, they are both things which have been with us for a long time and we're still tackling with it. And I would actually argue what I'm presenting now is a third, very different example of these issues. And what I want to do in this presentation is really give you some ideas coming, as Brad said, both from a lab and a field-based perspective, on what actually we may have been missing out in research, in the understanding of what we are doing. If you look at what we as economic botanists, ethnobotanists are doing, I think it's still fair, our criticism, which also involved Sarah Edwards as a co-author, that the field of ethnology has continuously focused on recording and preserving traditional knowledge, with all the gender-biased issues just highlighted. So it's about the recording of something. Key concerns on the other side have been related to develop high-value commercial pharmaceutical products, especially in terms of equitable benefit sharing. Let me remind you of the work of the Berlins here as an example. And there's a third theme which is coming in and closely linked to the previous one. It's this whole issue of the commodification of the sacred, a paper the late Derek Posse published posthumously, or it was published for him in the Journal of Ethnopharmacology. All these, they highlight something without really explicitly expressing it, and that is that we are actually not understanding the whole process which is actually happening. And this is, in essence, the link between plant science and, if you want, the pharmaceutical aspect. So it's the move from a living object to a commodity. In the most simple way, this can be analyzed, and it has not been done systematically in medicinal plant research, by something which economists and social scientists call value chains. And the value chain is, in a very broad sense, the sequence of activities required to make a finished product from its initial starting material to a final product. It's very important if you are in the business of making cars, which we are not, I assume. The simple need is that you need to make sure that all these things come together and you have a final product. It's also very important if you try to understand the social situations. Take the textile industry in Bangladesh as just one example, and the disasters which are happening there. The exploitation of people is part of this. Now in ethnopharmacology, it's actually quite interesting. When I did my field work, I was doing the classical things, working in the community, speaking with men and with women, and these were the growers, the collectors, the processors, and the healers. And the patients, if you want, the consumers, were sort of very directly linked. And what I'm arguing here is that we actually need a different way of looking at these things, connecting these various elements along the value chain. So these are some of these, if you want, sort of classical things. So what we commonly do is we look at this, what is happening somewhere, mostly in a small community, now more often also in an urban community, but we are not really looking at products which have a much more complicated avenue, if you want, from the starting material to the final product. These simple value chains are very important and nice to understand because of this, they're very simple. Take another example. This is what I call a local market chain. Here we have a grower and a collector who passes it on, who sells it on to a processor and seller, who may pass it then on to a healer. The healer can be a pharmacist, it doesn't matter. Or he may be a retailer, and then it goes to the buyer, patient, and consumer. So these are short, relatively short value chains, quite often national. And a typical and very beautiful example for this is something which comes out of the group of Fernando and colleagues, published last year in the Journal of Ethnopharmacology, and where she shows that the trade in herbal medicines This has a real importance in this case in the market in Ghana. This is the graphic extract which you see here, and you see the tremendous importance in these products. What she also says is most people selling herbal medicines were full-time traders who bought their wares from wholesalers and did not gather herbs themselves. As a result, they were generally unaware of the source of the plant material. If you're unaware of the source of the plant material, you are unaware of its composition. You're unaware of what it may have been adulterated with. You're unaware of the quality in a more broader sense. So what I'm saying is we need to find ways to integrate these various elements of value chains. Very briefly, another one, a more integrated value chain. This is an industrial one, where we have actually two lines, one going on a national market on the right-hand side, and the other one then via an exporter system into the international market. And again, you could cite numerous examples where we in China, or we in Europe, or we in North America receive certain materials which come from outside of the borders, and with all the implications, especially from my perspective, in terms of what is actually available. So with this as a basis, I want to give you one example of how we have been dealing with this in a very analytical way, and want to highlight what actually could be done. And this is using turmeric as an example. It's Tony Booker's PhD thesis, and he is interviewing growers, in this case in India, and farm workers in India, obviously, about the production of turmeric. So what we really want to understand is we want to understand the value chain of this medicinal plant from source to consumer. We want to understand what are the differences. Well, we first want to understand the value chains, but we also want to understand what are the differences between these various value chains in terms of the composition of the material and in terms of the livelihoods. Now, if you think briefly about the widespread debate, for example, about coffee and tea production, this is nothing new. This is simply an export value chain, and what you see here is the price per kilogram from the farm level to the final UK consumer. And as is the case with tea, even in a case like this one, obviously the difference in what the farm workers gets 7.5 rupees versus what is paid in the UK, the equivalent of 34,000 rupees, is tremendous. So this tells you how much of a value generation there actually is in this process. So, I said earlier, we sampled these products. We went, spoke with farmers, processors, market traders, etc. We had quite a wide number of informants in 3 regions in India. And what we did is we collected samples from each of these regions. We have different farm sites, and I don't have time to go into the details, but we have an organic farm, we have a more classical farm, we have smaller farms, we have larger farms, etc. We then went on and did quite a straightforward double analysis. Now, for those of you who are not in chemistry, this is sort of a little bit annoying, but I'm sorry, I'll just be a bit annoying. One is a very simple thin layer chromatography, which you see on the right-hand side, and the second one is on the left-hand side, a metabolomic analysis using NMR. So we have these 54 samples, and we basically analyze them. And what I want to show you here are just some examples. And making a very long story short, what you see is not everything which is sold as turmeric actually is turmeric. We'll say no surprise. It happens all the time. Right, but I think we can document it. Another important difference in this metabolomic analysis, if you look closely, you see that they are actually clustered in such a way that certain products are very different from the other ones. We've done other studies, for example, with salt palmetto, where the content in one of the bioactive materials varied by more than 200-fold from the least concentrated one to the highest concentrated one. And that's something which, in essence, you can see here. You can see how these products are processed in very different ways resulting in very different chemical and thus bioactivity profiles. This is in essence a similar way of representing it. I don't want to give you too much details. What you see here is more of a technical question, that in fact we are pretty good in separating curcuma longa out from the rest, but then we have a problem in between Xanthoryza and aromatica. They actually cluster together. So it's also tells you something about the limitations of this work. We did a similar thing with high-performance thin-layer chromatography. Again, I don't have time to give you too many examples. What I do want to show you is that with this method, we were actually able to really identify quite clearly where did we have what I have to call adulterations, where we have modifications to the materials which are not acceptable. You see here the sample 19, which is sort of difficult to see. It's the second arrow from the left. Is completely different from several other ones. The similar, the one, the black one. So we're actually able to identify this very well. Now, drawing these things together, what does this all mean? If you analyze these data, you see that certain value chains are actually more likely to result in high-quality products. One of the ones which works extremely well is, maybe unsurprisingly, maybe sadly, depending on your point of view, what's called an integrated value chain. A value chain where, in essence, the end supplier has the greatest control over the whole process. These are the best products in terms of the chemical composition. We can see that fragmented value chains result in very poor products. We can see that some of the national value chains are actually likely to lead to poorer quality than some of the international ones. We have contamination, we have examples for this which I can't show you. So I think it offers an opportunity to think about products and how they derive from the starting material in a very different way. So what I'm trying to tell you here is, whatever we are doing as ethnobotanists, ethnopharmacologists, economic botanists, there is a value in value chains. There's an opportunity to do something where we really try to link things from the starting material to the consumer. And that's really what we need to do. And I think it's an interesting concept which we can use in order to develop things in a new way in ethnopharmacology. Now, what's important from my perspective, working in the context of pharmacy, is really this quality issue. And I think we have to be very conscious that if we don't get the quality questions right, it will be a disaster, both for the consumers, and there are enough examples in Europe, in China, in wherever, but also for the producers. So I think that's really, for me, a very strong argument to think more about a regulated market and a way of ascertaining that the products are of adequate quality. With this, I want to close. Tony, as I said, the turmeric project is Tony Booker's PhD. The value chain concept has developed in my mind over the last years, and I think it is one where I'm keen to share ideas how we can take this forward as a scientific community. With this, I want to thank you.
Time for a question. Trish.
This is a great topic, and something that, of course, I'm extremely intimate with in the U.S. And I think what's happened is your comment about the end user being more important is actually changed in the U.S. as well because of the FDA new GMPs, the manufacturing practices. As a manufacturer, is the one who's required for the accountability because the supplier is no longer responsible. Even the laboratories are not really responsible. So there's bad science going on to validate ID, to validate qualifications. So this is really important, although the problem becomes that those who are at the end part of the chain are also those who are concerned about the bottom line and therefore do everything possible to, get profit and undermine the system whenever possible. So
I fully agree, and I think it's a topic which has been around for a long time, but what I'm arguing here is we need a way to conceptualize it, to frame it, and my argument in the US context then would be there is a need to look at both sides, and we need to find new ways to link these producing groups, whether they are peasant groups or individual farmers, on a national level in country A with the retailers and producers and consumers in their main consumer markets.
Well, certainly if they start to identify the plants well and provide some of this quality, then they're going to have the marketing ability maybe to be a preferred vendor. I mean, that.
But the problem is a little bit that there are lots of initiatives like this and they don't really capture the quality side. They claim they do, but they don't. And I think that's where the whole quality assurance issue and how you do this over the whole process comes in. So you need a mechanism for quality assurance, which technically is provided via GAP, GLP, GMP, etc., but I don't think it's properly implemented.
Thank you very much.